Hello.
Hi, how are you?
Fine. How are you doing today?
I'm okay. I'm having problems with these two medications, so I brought them in to ask questions.
Certainly. Shall we sit down and look to see what you have?
Yeah, I want to discuss these,
Okay.
please.
Well, let's take a look and see what medications that you're on. And that's the first one, hydrochlorothiazide. And you take this once a day. And what time of day do you take that?
At
You're
night?
taking that in the evening. Okay. And this one does tend to cause urinary output, and so you can keep you up at night. Most people take this in the morning, and that's probably a better time to take this in the morning, so you're not having to run to the bathroom in the evening.
Oh, I see. It would be better in the morning, so there's less going back and forth at night while I'm still
I
asleep,
think you'll
really.
find that that'll help. And you're taking this for your blood pressure. Is your blood pressure being controlled pretty well? Do you know what your readings are?
Typically around 120 over 90, maybe 125. Goes back and forth between those two. Never big changes, but a
Okay,
little
but the bottom
fluctuation.
number is 90 usually.
Yes, the bottom number's 90.
That might be a little bit high. Maybe we'll have to talk to your doctor about adjusting your dose on this. 90 just tends to be a little bit high. You probably would want that a little bit lower.
Okay.
And the next one that you have here, Glipizide for blood sugar. And what have your, I see you have your readings here. Can we take a look at those? Well, the readings look very, very good. Are you having any unusual symptoms, or are you feeling okay?
I am feeling a bit strange, actually. I'm quite bothered by it. On this medication, I feel like I'm gaining weight and my body is just acting different.
When when do you when do you have the sweats?
Hmm. It probably started about a week ago and has been going on since then.
Okay, what time of the day? Is it all during the day or
Yeah, it's all day. Well, sometimes because I take that medication in the morning. So when I get up, I kind of feel nauseated, just off. My body just seems to be reacting to it strangely, like I'm almost gaining weight.
all right? How about at night? Do you feel all right? Do you sleep all through the night pretty well?
Yes, I'm sleeping through the night just fine. Yes.
Okay. Well, since your readings look pretty good, the blood sugar readings are good, but you're having symptoms where you're gaining weight and you're not feeling well during the day, we may have to talk to your doctor about either adjusting the dose of this or maybe putting you on something entirely different that controls your blood sugar. There are lots of choices in medications for controlling blood sugar, so maybe this one is just not the one for you. There may be something else out there that you do better on and that does control your blood sugar. I can give your doctor a call and tell him that you're having these symptoms and see if we can get you set up with an appointment shortly so that he can adjust this or maybe switch you to something else. Does that sound all right? Okay,
Yeah.
good. It's important to control your blood sugar, but it's also important that you feel good as well. And so if we're controlling blood sugar, but you're not feeling good, then that's something we need to work on.
Okay.
I'll give him a call.
Okay. And also, if it's possible, just for the bottles themselves, if this cap could be on all of my pill bottles. This one I find difficult. It hurts my hand because of my arthritis, and this one's better for me. Also, the labels on the bottles, if the font could be increased to make it easier to read for my eyesight, that would be a big help. So the larger labels and then the different caps, if I could have those changes.
We can make a note in your file that you want the easy open caps, and then you'll get those from now on. And we can also notate that you want large print on your labels, and that's something we can do too.
Wonderful. Okay.
Good. Is there anything else that you would like to talk about today?
Just in terms of this medication, finding a different one that really suits me better is where I'm leaning. I don't feel like this really meets my needs. I don't like the way my body responds to it. So if I could find a different pill to control my blood sugar, I would happily get rid of this one.
Certainly, that sounds good. There are lots of choices. Used to be that we didn't have so much to pick from. Now there's a lot of different categories of medications that we can pick from. And I'm confident we'll find something that will work for you and that you can tolerate.